Narration: Kalbitor Vial is used to treat an acute attack of a certain immune disease called hereditary angioedema, HAE. It works by blocking a natural substance in the body that can cause symptoms such as rapid swelling and pain in various parts of the body, including the hands, feet, limbs, face, tongue, or throat. It can also help with symptoms such as abdominal pain/cramps, diarrhea, or vomiting if the attacks involve the intestines. It's important to note that Kalbitor Vial does not cure HAE, but it may lessen the symptoms during an acute attack. Attacks of swelling may occur without reason, but anxiety, stress, sickness, and surgery may trigger attacks in some people. The dosage and timing of Kalbitor Vial should be determined by a healthcare professional. Before using Kalbitor Vial, make sure to read the medication guide provided by your pharmacist. Your healthcare provider will inject this medication under your skin in the abdomen, thigh, or upper arms. You will receive 3 separate shots, which should be separated by at least 2 inches. An additional 3 shots may be given in a 24-hour period if the HAE attack continues. Do not receive an injection into skin that is tender, red, or hard. The dosage is based on your medical condition and response to treatment. Be sure to tell your doctor if your condition does not improve or if it worsens. Some common side effects of Kalbitor Vial include bruising, itching, redness, and swelling at the injection site. You may also experience nausea, fever, or a stuffy nose. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. This is not a complete list of possible side effects, so if you notice any other effects not mentioned here, it's important to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects. You may also report any side effects to the FDA. In Canada, you can also call your doctor for medical advice about side effects and report them to Health Canada. When taking a Kalbitor, you may rarely experience serious allergic reactions, which can be potentially fatal. If you have a severe allergic reaction to this medication, you should never use it again. Since the symptoms of an allergic reaction and the condition this medication treats can be similar, your healthcare providers will closely monitor you while receiving this medication in a clinic or hospital. Seek immediate medical attention if you develop any signs of an allergic reaction, such as rash, itching/swelling, severe dizziness, trouble breathing, or chest pain. It is important to follow the dosage and timing recommended by your healthcare provider for the best results. Before starting a Kalbitor, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions. It's important to discuss your medical history with your healthcare provider before using this medication. If you are planning to have surgery, be sure to inform your doctor or dentist about all the medications and products you are currently using, including prescription drugs, over-the-counter drugs, and herbal products. If you are pregnant, only use this medication if it is clearly necessary. Make sure to discuss the potential risks and benefits with your doctor. It is also important to consult your doctor before using this medication if you are breastfeeding, as it is unknown if the drug passes into breast milk. It's important to be aware that Kalbitor Vial may interact with other medications and potentially affect how they work or increase the risk of serious side effects. This means it's crucial to keep a comprehensive list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's essential to always seek your doctor's approval before starting, stopping, or changing the dosage of any medicines. This will ensure the best possible outcomes and reduce the risk of any adverse effects. If someone has overdosed on Kalbitor Vial and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to call 911 immediately. Otherwise, contact a poison control center right away. U.S. residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Kalbitor Vial is used to treat sudden attacks of hereditary angioedema, HAE, in adults and children. It helps to reduce the swelling in the hands, feet, and face, as well as in the airway and stomach. The dosage and timing of Kalbitor Vial should be determined by a healthcare professional based on the individual's condition and medical history. It is important to use this medication as directed and to seek immediate medical attention if symptoms do not improve or worsen. Kalbitor Vial is typically administered by a healthcare professional and should not be self-administered without proper training and supervision. Be sure to take each dose of Kalbitor Vial as prescribed by your doctor. If you happen to miss a dose, consult with your doctor or pharmacist immediately to establish a new dosing schedule. This medication, Kalbitor Vial, is given in a clinic and is not meant to be stored at home. It is used to treat sudden attacks of a certain inherited form of swelling, hereditary angioedema. It helps to relieve symptoms such as stomach pain, nausea, and vomiting. The dosage is based on your medical condition and response to treatment. It is important to receive this medication as soon as possible after symptoms appear. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.